Hi, we have with us Jaqueline today, who's been a patient for, I guess, almost a year already.
Just about.
Yeah. And when you first came to see us, what you had told us was that you had been diagnosed with celiac disease. You also were a type 2 diabetic. You had high blood pressure, stomach problems, headaches, fatigue, sleep disorders, pain, balance problems, and weight issues. Does that pretty much cover it?
Yes.
Okay. So you've been a patient for a while, and now you're more of like a maintenance patient. How much weight have you lost? Let's start with that.
A total with you guys, about 35 pounds.
About 35 pounds, and you don't look like you need to lose a pound more,
No,
so that's really wonderful. In fact, there was a time I think you were worried that you might lose too much, but you finally leveled off. And so what we did is we ran some blood work on you, and we found what was going on in your body metabolically. We took x-rays of your spine because for us spinal care is so critical, and we put you on a program where we were adjusting your spine regularly, and we walked you through nutritional protocols. How long did it take before you started to notice a change?
I would say within a month.
Within a month, you were noticing a nice change.
Right.
Is there anything that's completely gone that you just no longer even notice you have at all? Let's start with like the stomach trouble. I know that's been really kind of a stickler for you, where you still have some problems. What about the headaches?
Headaches are gone.
Fatigue?
Fatigues is gone.
How you sleeping?
Sleeping pretty good. Unless,
Pretty good.
Yeah.
That's awesome. What about your pain?
I really don't have any pain.
You don't even remember having it.
No, it's like...
When I go through this with patients, it's hysterical because I say, I don't remember I had pain. No, you wrote it down. It was one of the main things you came here for. What about the dizziness and the ringing in the ears? That's always a little trickier for us.
Yeah, that's gone.
That's gone. Vertigo gone. That's awesome. Tinnitus gone. And that's a harder one for us. Have you been finding, the diet changes, the modifications we made? Has it been difficult, easy, challenging?
In the beginning it was a challenge, but now it's easy. It's like...
It's just the way it is. And you've been to our lifestyle classes, so for those of you listening, we have a lifestyle coach who gives classes in the office to teach people recipes, where they shop. With a celiac patient, we have to be a lot stricter than with most of our patients. But the one thing I would say, Jaqueline, is you really did everything we asked, and the results have been magnificent. Your blood sugar was, how high was it in the beginning?
When I started, it was almost 300. I couldn't get it under control.
Couldn't get it under control. What was your A1C, do you recall?
My A1C, I think when I started with you guys, was maybe close to 10, I believe.
And the importance, if you're listening to this video, is we have patients who come in with, an A1C is a blood sugar marker. It shouldn't be higher than 5.7 or 5.6. And when we have patients come in with high blood sugar, high A1Cs, they've been told, and the same thing with cholesterol, that it could never come down without medication. And is that true?
No, that's not true.
It's absolutely not true. So, here's a patient who got under care, did what she had to do. Her last A1C, and it's probably even better by now, was 5.9, down from 8.0. I'm sure if we run blood work now, it'll probably be in normal range, and 5.9 is already lower than a classified type 2 diabetic, which is 6.4 or above. So you've done amazing. You've been a great patient.
Thank you.
And if someone were listening to this video, what would you say to them?
Do it. You have nothing to lose but to get your life back.
You have nothing to lose but to get your life back. Jaqueline, thank you so much.